Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist. In today's video, I'm going to be demonstrating how I make a dupuytren's orthosis after a dupuytren's surgery or surgical procedure. So I'm going to be demonstrating it for example on the pinky finger, but you can translate these skills to any digit. And without further ado, let's get into it. So for our dupuytren splints, what I like to do is make a pattern with a paper towel first before I cut out my thermoplastic. There's a couple of different patterns that you can try and create. Sometimes I'll do one that starts on the fingers and wraps around the thumb complex to the back of the hand. Sometimes I feel like they don't have that much resistance or kind of much of a contracture left, and so I find that just doing a simple like rectangle formation actually works really well. So that's the one that I've been doing a lot lately, but I think again it's going to depend on your patient. So if we have them lay their hand down, and then I just like to make a general trace. I give like a little bit of extra room on the sides and then come down the hand. And then I also like to note sort of where the DPC is sort of on either side, just so that you know kind of where that is in case you're making sort of that version where you've got a leg coming out where you're going to wrap it around the thumb. And then I mark kind of where the wrist is as well. And so then I take it off the patient and I just finish sort of this little rectangle here like that. If I was doing the version where I was going to wrap it sort of around, then I would again sort of note where the DPC is. I'm kind of making an estimate here. And then I usually make an extension piece sort of like that, and then I kind of estimate where their thumb MCP joint is at, and so we want to make a little hole there. And then I just kind of connect the dots, so I just sort of loop it around. Patterns don't have to be perfect in my opinion, so that's like the secondary version, right, where we've got this extension piece. This is going to be like a little hole that you're going to poke through for the thumb so that it sits on the hand that way. So now I'm going to cut my pattern out. And again, I'm not a big believer in like patterns have to be super perfect, but I do think that they really do help you if you get a very close estimate so that A, you don't waste thermoplastic, B, it makes it a lot easier to manage and deal with versus splinting with a lot of extra thermoplastic is actually kind of difficult. It's just like more things you have to figure out how to hold onto. So definitely recommend making patterns for splints that you can't easily see the pattern for. I'm like a very bad 2D to 3D viewer. Like I have to make a pattern sometimes to be able to see like, oh, that's how it's going to sit on my actual hand. And then for this one, we've got like a little hole, you know, so I can kind of estimate like, okay, yep, that's where I want my hole to go. That's how my orthosis is going to sit. And then they've got this piece around the back, which I can trim down a little bit of that as well. So if we're doing it sort of the full version, if you feel like you just need a little bit more support, some people just like that version better. It's totally fine. That's kind of what that pattern would look like versus if we're just doing the version here. That's going to be your paper towel pattern, and then you can transfer either of those onto your thermoplastic. So I've got my pattern and then my thermoplastic. So here's the pattern and how it's going to sit, line up with the hand. And then I've got a big scrap of plastic, which I normally wouldn't mark with a ballpoint pen, but I don't have splinting equipment at home. I usually use those little Sharpie markers that are, I think they're called China markers actually, the wax pencils. So I'm just going to draw kind of an estimate, and then we'll use our hot water to cut it out. With this really thick type of material, which I like to use probably 1/8 around there for most dupy splints because they need more resistance, I usually heat the material and then cut it. It will save your thumbs, and it will also make the plastic actually seal as you cut it when it's warm, so it makes the edges a lot softer too. So I've got my plastic piece cut out. I'm checking the fit. That looks pretty good. I'm gonna toss it into the water. Let's get it all heated up so that we can mold it on our patient, me. And with duputrens, after they've had surgery or their collagenase injection or any of their procedures, tenotomy, any of that stuff, our goal is to maintain the extension as much as possible. And so you really want to try and get them into as much of an extended position as you can. Not necessarily that we have to hyper-extend the joints, but we know that with thermoplastic it tends to settle a little bit back once it's dried, so I do usually try to encourage just a little bit if I can, depending on the patient's flexibility, because I know that it's going to settle a little bit in the brace as well, in the plastic. So we just try to get them as much as I can. And this material is going to take forever to melt because it's like 1/8 thickness, so it's pretty thick stuff. But I do usually like to use that thicker material, either 1/8 or like 332, I think is the other width. That can be pretty good. Okay, we're really close, just a few more seconds. Okay, that looks about good to me. So again, drying it off. And then I like to have the patients in supination. Then I just place the plastic on them. And then I just mold it down. Super easy. You don't have to, work super hard. Sometimes I'll have people come up kind of in this position so I can see it from the side. But just trying to get that material to mold. And keep them nice and extended. And usually with these dupuytren splints, every surgeon's a little different. The surgeons I work with tend to prefer that the patients wear them at least 3 months at nighttime only, just for sleeping after their surgery. But again, I would check with your surgeon that you're working with to see how long they want them to wear it. Most of the time, our surgeons don't really prefer them to wear it during the day, which I actually think is awesome because we kind of want these people moving as soon as possible. We don't really want to immobilize them typically for very long. Okay, so that's looking pretty good. We do a side check. That looks pretty straight to me. And the trickiest part, I think, with dupi splints is getting the strapping just right. So the style that I tend to prefer, I like to do one strap around the wrist, one around the MCP joints, and then a strap around the proximal phalanx, and then the middle phalanx. So I like to actually mark this for sure with a pen or a China marker. So I'm going to mark like that's where I want my wrist straps to go. I'm going to check sort of MCP on the pinky and then sort of DPC on this side. And then I'm going to check sort of where my proximal phalanx is on both sides. I put that a little too high, whoops. And then the middle phalanx. And remember that the straps are going to be somewhat diagonal facing. Ignore this second one here. Because the pinky is so much smaller and the height difference between where our anatomy is, so the straps are going to sit sort of on a diagonal to hold it in. So I'm going to go ahead and get straps on this puppy so you can see what the final product looks like. Okay, back with the finished product with our strapping system here. We've got 4 straps, one at the wrist, one at the MCP joint, the proximal phalanx, and then the middle to distal phalanx. As we apply this, you're gonna strap, I like to strap the wrist first just to get the splint in place and secure. So it goes sort of around the wrist, and then we've got one across the MCP joints, which doing this one-handed is exactly how your patients are going to do it too. So it's good to make sure that they can do that as well. So across the MCP joints, for this strap I often like to use neoprene or a stretchy material so that it hugs them into the orthosis. Just personal preference, but I'm just using Velcro scrap material. So I'm just using what I had. And then again, proximal phalanx, want to make sure that it's holding that joint in. And then the distal phalanx or the middle phalanx is just holding them into the splint. So that is sort of what our finished dupuytren's post-op orthosis might look like if you are making this specific style. And yeah, I hope this video was helpful for you. Orthosis fabrication, splinting is a huge part of being a hand therapist, so it's really, really crucial to know these skills. And I think that it can be hard when you're a new therapist or in a situation where you don't have much mentorship to learn these types of skills. So I hope this video was helpful for you. If you enjoyed it, give it a thumbs up. Subscribe to the channel so you don't miss any more hand therapy content. Check out this playlist that I'm linking here for more splinting tips or hand therapy tips and tricks. And I look forward to seeing you in the next one. Thank you.